Feel free to join us and engage in the conversation around COVID-19 in tribal communities. We have 4 great panelists with us today from various organizations, and one who is from our own, the Coalition to Stop Violence Against Native Women. So welcome everyone, and my name is Florpia. I'm from the Pueblo and Navajo Nation, and I use she, they, and him pronouns. And I'm the Sexual Violence Project Coordinator for the Coalition to Stop Violence Against Native Women. And today we are hosting a discussion on COVID-19 in tribal communities. So for today's agenda, we will be doing a Zoom 101 until 1:10, and then we will be introducing our panelists from 1:10 to 1:15. And at 1:15, we will start with our questions for our panelists, and we will be having our panel discussion until 1:45, at which point we will take a break for 10 minutes. And then we will resume our questions and then have an open discussion at 2:20 and close at 2:30. So that is our plan for today's event. And let's get started. So for Zoom, the Zoom menu is located at either the top or bottom of your screen, and it contains several features that can be used and throughout at any time throughout the meeting. Up here is an example of what the Zoom bar looks like, located on the screen. So the mute silences and unsilences your microphone. It allows everyone to hear what you're saying and to provide your perspective to the group. The invite button allows you to bring more people into the Zoom meeting if the host allows for that. And then next is the share screen. This allows the participants to share their screens, such as I'm doing with the presentation itself. Next, we have the chat. This works like Facebook Messenger, but without any of the GIFs or stickers. So you can send messages to everyone, or just to the host of the meeting or to a specific panelist. Next is a recording. So if the host allows it, you can record and download as much as the meeting that you want. And then next is a leave meeting. So you can leave the meeting, and if you're, this is especially useful if you have material that is difficult, or if you need to take some time or space away from the material that is being presented, that button is there for you. And then more allows you to raise hand and as well as other features. So another feature is the views to choose from. You can have a speaker view, which shows which speaker is speaking. And then there's the gallery view, which shows all participants. And then the full screen, which maximizes the full screen potential. So here it shows the icons for the gallery view and speaker view, so that you're able to change it to whatever fits best for you. I hope that helps with understanding how to work with Zoom. I'm gonna go to our introduction of panelists and ask if each panelist could take a moment to provide a brief introduction of themselves. We will start off with Stephanie. So thank you.
Hello, everyone. My name is Stephanie Cassidy. I'm Ogallala Lakota. I live here in Seattle, and I grew up here in the Pacific Northwest and in San Francisco. I'm the Gender-Based Violence Program Manager for the Seattle Indian Health Board. And my background is in sexual violence and gender-based violence.
Our next panelist is Tiffany Jiron. Tiffany, could you introduce yourself?
Good afternoon, everyone. My name is Tiffany Jiron, and I am from the Pueblo of Isleta. This is where I grew up and where I still currently reside. I'm a mother of 3 young little ones. I am the advocate coordinator for the coalition to stop violence against Native women, and I have been with the coalition for a little over a year now. Thank you.
Kristen Yepa, would you be able to introduce yourself?
Sure. So my name is Kristen Yepa. I am from Jemez Pueblo, and I currently work as the Director of Public Health Services for Tiffany's hometown of Pueblo of Isleta. And I have almost been here a year. Previous to taking this position, I was in Jemez Pueblo for about 10 years, working in public health. My background is in public health nursing. I have my master's in public health, and I'm currently working on my doctorate in nursing right now. But most of my experience has been in tribal communities working on public health initiatives.
Thank you, Kristen. And would Kristen Bitsuie introduce yourself, please?
Yes, absolutely. Yate, and thank you for inviting me here. I am an enrolled member of the Navajo Nation, and I serve as the Tribal Healthcare Outreach Education Policy Coordinator for National Indian Health Board. And I provide technical assistance, education, training, and on CMS programs such as Affordable Care Act, Medicare, Medicaid, the Children's Health Insurance Program, and also all the changes that happen within the Indian healthcare system. I take that right directly back to the tribal communities. And I serve as the national advocate for Indian country that drives a lot of the Indian health system and connects some of the consumers to get better health care. And I've have experience in Indian health service, the tribal and urban programs as well too. Thank you.
Thank you all for being here today. I really appreciate it, and I'm really excited to get asked all these questions and see what the current field looks like for you all. So I'll begin with the first question. Like I said, if you want to decline, feel free, and if you want to provide your perspective, you can, but we'll go in the order that we did introductions. So the first question that I have is, what is your organization doing to promote safety during the pandemic?
Hey everyone, so Seattle Indian Health Board is a medical clinic. So we actually are doing quite a bit to promote safety during this pandemic. So here at our clinic, we have medical, behavioral health, dental, pharmacy, and other services, as well as nutrition and family services, gender-based violence, and a program for our unsheltered relatives. So we've been working really, really hard to provide a social safety net for the relatives that come into our clinic throughout the pandemic. We've been working in person to do so and promoting safety and wellness through that. We also have our research division, the Urban Indian Health Institute, that has been doing absolutely incredible work around vaccinations and COVID-19 health indicators. They actually recently released a report about the data genocide of American Indians and Alaska Natives in the COVID-19 data, showing how our folks' data is not being represented correctly. And they've been doing a lot of resource and engagement around what vaccines are, myth busting, and promotion throughout our community.
So, oh, sorry.
Oh, sorry.
So I think, as far as what we're doing in terms of at the Pueblo of Isleta and the organization, I think it's the Isleta Health Center is a tribal health center that has compacted its funds, but we're also functioning under a command structure. And so as a tribe and in addressing the overall COVID response, we've instituted an incident command where my primary responsibility is over operations. And because the public health services is under the health center, we're able to maximize our resources here. So what we've done, we're looking at it at an organizational level, but we're also looking at it at a tribal level. So so we're kind of doing both. At the organizational level, what we've done is we've instituted a health questionnaire that we ask all employees. So we do symptom monitoring, we do testing. Even at the community level, we have increased our capacity to test individuals within the community so that we can respond and mitigate any spread quickly. We've also have done a lot of work around vaccinating the community. We continue to look at the data. We're very data informed and data driven. And so I spend a lot of my time analyzing the data that we have that is specific to the Pueblo of Isleta so that we can make informed decision on how we can promote safety during this pandemic. And so we also institute a tribal a communicable disease code, which helps to provide some structure and really clearly defines the roles. And so part of my other role is serving as the tribal health officer, where I work in the incident command structure, but also concur with the governor here at the Pueblo of Isleta to implement public health orders that really impact the community and the Pueblo of Isleta organization in implementing protocols that really help to promote the COVID safe practices.
The Coalition to Stop Violence Against Native Women has done a lot of important work to promote safety during the pandemic. Our team has provided information to the general public on social media, on where to access vaccinations, and provided information on how to stay safe by asking our relatives to continue to wear masks. The month of June and July, we held a social media campaign. I continue to wear my mask because, and then folks were able to fill out the blank. We at the Coalition want to keep our tribal communities safe, as we know our little ones under the age of 12 are our most vulnerable and precious populations. Our babies don't have access to the vaccination yet, and we want to model and encourage folks to consider safety for the future generations. At all our meetings and trainings, we have kept everything online and virtual. We have moved a lot of our events to occur virtually as well, like our 5K run and the Native Youth Summit. Our Native Youth Coordinator teamed up with Three Sisters Kitchen of Albuquerque last year to develop a cooking class for survivors in early spring of 2020 through the summer of 2020 when food was very scarce in the stores. And it was very scary at the time for folks to go into the stores at the onset of COVID. This program provided fresh vegetables, eggs, grains, and other food items to homes. And they were able to participate in a cooking class each week while earning a $100 stipend for each time they participated. They have also been working very hard in building garden boxes with lumber so that tribal communities can grow their own food during the pandemic. Let's see, also we have established a advocate community group, and it's a group of tribal advocates that meet bi-weekly. And we've also provided stipends for advocates, which were approximately $500. And that money was for them to take care of themselves, take care of bills that they needed help with, any type of support that they needed at that time. That money was theirs to do whatever they needed to do. We gave those out last year in 2020 and then again in February of 2021. We've also provided PPE, plexiglass, cleaning supplies, masks, thermometers to help service providers that were still open to care for their survivors, especially our shelter services. We've also supported our advocates by providing care packages. Yeah, so those are just some of the things that we did as a whole organization to promote safety during the pandemic. Just really encouraging our general public, our tribal communities to continue to wear a mask.
So for National Indian Health Board, we're a tribal-driven organization, and we're committed to providing accurate and cultural competent COVID-19 information so that it can be shared and used in the tribal communities. So some of the things that NIHB has done is doing advocacy to Congress, the White House, the Indian Health Service, and other agencies within the Department of Health and Human Services on various relief and recovery funding packages. So NIHB strongly advocates for the funding to go directly to the tribes rather than through a grant process. And NIHB's leadership also testifies on the impact of COVID in tribal communities and extreme need for services like behavioral health and mental health, expanding the telehealth as well too, and supporting the traditional healing. And early back in the pandemic, we were all trying to figure out what COVID really was. And NIHB created a COVID specific website for tribes so that they can visit to get a lot of the public health information and resources, as well as funding and policy analysts on some of these relief and recovery bills that were coming out. And NIHB also developed many COVID related safety fact sheets, and that can also be seen on our NIHB COVID website, which is www.nhb.org/COVID-19. And that's our Tribal Resource Center. And last summer, NIHB also launched its Act of Love campaign that focused on wearing masks as an act of love. So now that we're switching gears, the campaign is also including the vaccine. So getting a vaccine is also an act of love. So that's the campaign that we are doing right now and focusing on Native youth so that they can get vaccinated. And we're proud to lift up a lot of the youth as well too. And our community organizers and elder caretakers, and those are some of the focus groups as well. They are also revitalizing the language and our traditional ways that we do. And so that's the reason why youth is extremely important. They're impactful and also influential, and giving back to the community is also an act of love. So empowering a lot of our Native youth and supporting their choice to get COVID-19 vaccine. And that's something that we are really focused on right now. And then over the last year and a half, National Indian Health Board, Public Health Policy and Programs Department hosted several webinars and trainings on infectious disease prevention for tribal healthcare and professional, and also the frontline workers. And NIHB also held a few of the COVID-19 tribal listening sessions, which is an opportunity for tribal leaders, tribal health professionals, and tribal members to share about their own tribe's vaccine efforts, on their experience, or maybe they have concerns around the hesitation. And it's also an effective way of community outreach. And hearing from a lot of the tribal communities is extremely important to a lot of NIHB's work. So we appreciate all of the input that come from the tribal leaders, technical advisors, the subject matter experts, and especially the community members. So those are some of the few things that NIHB has done.
Thank you all for your responses. From fact sheets to COVID screenings, it just seems like you're all doing so much to help with this pandemic. So thank you for your efforts. So for our next question is, could you provide some information about the impact of the variants of COVID-19, such as the Delta variant? Thank you.
So I can't speak too much to this side for SIHB, but we are an epidemiology center as well. So it's really important for us that we're modeling behavior that is like helping with the safety of our folks. So we maintain like the safety and the outreach that we've been doing. Yeah.
Yeah, the variants of COVID-19, such as the Delta variant, we know it carries a huge risk, if not more than coronavirus, possibly more, for more disparities, especially in our tribal communities. With COVID-19, we saw so many disparities in our own tribes, and we want to encourage our relatives to continue to practice safety measures like wearing a mask, continuing to getting vaccinations, and to stay at home if they can. The impacts are the same for the coalition. We understand that Pueblos are still closed and support that, because keeping our tribal communities safe is our, keeping our communities safe of COVID and violence is our mission. So we want to continue to model that and continue to support safety.
And I guess the perspective and feedback I can provide in terms of the Delta variant, I think it's very difficult. I mean, I think from a health center perspective, and even looking at the data, is our access and ability to test the samples we get for the variant, right? So we're working with the state of New Mexico Department of Health to let us know if the variant is present in our communities. And I think that's been a struggle, because we hear it out there that there is a Delta variant, but we have to improve our communication with our Department of Health and other agencies so that we know and we can get response back from these laboratories quicker, so that we would know if the variant is present in our tribal communities. And I'm not sure. I mean, I think maybe Kristen or Stephanie can help answer this too, is just wondering if tribal communities are informed and tracking the amount and the percentage that Delta variant is present on tribal communities. But it's definitely something that I have had difficulty figuring out. I think we can just go by what the state level is and percentage of presence with the Delta variant. Again, we're definitely looking into this and seeing how what Tiffany mentioned is really reinforcing the safe practices of wearing a mask and really encouraging our family members, our relatives, our communities to really consider getting vaccinated. I think being on the front lines here and responding and trying to stop spread, what we've seen is the vaccine does work. I mean, we've had a lot of protective measures and seen a lot of protective factors play with the vaccine and exposure. And so we know it works. And it's unfortunate that some people don't want or don't choose to get vaccinated. And then we see the devastating consequences of that. We see individuals really suffer from severe, impact on their bodies or hospitalization. And, if we know that this vaccine can protect against hospitalizations and death, I just wish more people would be willing to choose to get vaccinated. And I think that's one thing that this Delta variant is helping. I think the media is really doing, heightening the awareness. So there's definitely a heightened awareness in the communities we're serving. And I think it has kind of helped us to be able to vaccinate more people, or more people are starting to consider getting vaccinated, which is good. But it is still scary. Again, CDC just put in their mask mandate again. And so having to reinforce wearing a mask is really important. But I'm kind of glad that a lot of the Pueblo communities have never gone away from wearing a mask, right? So that's something that I felt has been a really good protective factor for the tribal communities, is that we're still very conservative, but we're also trying to balance being conservative and very safe with the states that are already opening up and the nation opening up. And I think it's going to really be a fine balance of figuring out how to push the best approach going forward, knowing that the states are opening, everywhere around us is pretty fairly open. But that's one thing that I think the Delta variant does impact tribal communities right now.
Yeah, I'd like to echo that because, here at SIHB, we've been offering the vaccines since Washington State got the Moderna vaccine available. And I think that there's a lot of uncertainty with the Delta variant right now. It's really hard to know how deeply it's going to impact our communities, but we also know that our communities are at such a higher risk. So we have to be protective of our community members and of our relatives. So I know SIHB is still pushing vaccines, and we've actually had really great rate of vaccination rates. And I'm really proud of the community members for being open to it and taking the community care in mind first and foremost, caring for our elders, caring for our immunocompromised, because we are in an urban area and a lot of our folks are immunocompromised or unsheltered. So they're at such a high risk.
Thank you for these perspectives. It really sheds light onto the issue regarding the Delta variant and what our communities need to do, especially in terms of wearing masks, getting the vaccine. And so I wanted to ask Kristen if you wanted to provide any perspective from the National Indian Health Board, or I can also move on. So.
Oh, absolutely. I would like to just have a few things here. So, as you know, both of my co-hosts, panelists here have mentioned, Delta variant is very contagious and than the original COVID virus. So our communities need to be informed about how it could impact them. And as many of you may have seen in the news, that Delta variant cases have been confirmed in Navajo Nation. So NIHB encourages everyone eligible person to get vaccinated. The COVID-19 vaccine has also proven to be effective in preventing hospitalization and deaths from the Delta variant as well too. So we're seeing a few increases here and there within tribal communities when it comes to the COVID-19 vaccinations administered from last week. And I think some of you might also know that a lot of this data is really hard to get as well too. The tribal communities are probably right now the best place to go to in order to see what kind of data they have, what's administered, and also looking at some of the IHS facilities and the tribal facilities as well too. And I know that some of those facilities are also administering to non-natives, so the data can also be kind of skewed in that way. So it's kind of interesting how some of that happens. But we are looking at some of those areas where we're able to get a little bit more information, and that's directly from the tribes themselves. And so I guess the other thing too is that the Delta variant seems to be motivating a small group of individuals to get vaccinated, which is good, and that's great news. And that's exactly what we want too. So our tribal communities need to be safer and more resilient against the Delta variant. So if we continue to keep vaccinating our tribal members and continue to work to reduce the vaccine hesitancy among American Indians and Alaska Natives, a couple of weeks ago, NIHB was at Choctaw Indian Fair for the Mississippi, or in Mississippi, promoting our Act of Love campaign. And there we saw a lot of Native youth getting vaccinated. And a few said that they chose to get vaccinated because of Delta variant. So, because of the Delta variant, it's getting into a lot of the tribal communities now, and some of these tribes may choose to enforce the mask mandate again. But what's interesting is that a lot of our tribes already have those guidelines set, and some of them didn't fray away from it. And some of them, stayed with that until they felt more comfortable, which is good because nobody knew Delta variant was going to be coming about. So, and we encourage um, a lot of what we do at NIHB is to listen and to obey to a lot of their local tribal government and their policies, and making sure that they do get vaccinated and try to give them the right information and be transparent about that information as well. And also, this Act of Love campaign has been something that is a way for NIHB to share with a lot of these tribal communities, which is, watching your distance, washing your hands, and wearing masks. And the more we keep saying it, and the more we tell them that that message is going to hit a lot of the tribal members. So, thank you.
Thank you for that information, Kristen. Um, so our next question is contextualized around the according to the United Nations, there is a shadow pandemic alongside the COVID-19 pandemic. And what this shadow pandemic is described as is an increased violence against women. And so I wanted to ask the question about how your organization has addressed the issue of the shadow pandemic, whether you've seen this issue coming up in your communities, and how you've supported survivors during this time. If Stephanie could begin, thank you.
Yeah, absolutely. And thank you so much for asking this question. We already know that our women and our femme identifying folks get harmed at much higher rates and so much more cyclically. And this disparity has really been exacerbated during the pandemic. I know in my own role as an advocate and as a case manager, I've seen I started at SIHB actually right at the beginning of the pandemic, and it was honestly pretty heartbreaking to see how many more folks were coming in for services, but I was also really thankful that SIHB is here to provide them, because we definitely saw a large increase. And as things have opened up, we've actually had a decrease in folks coming in for intakes. But we've been working to support survivors in the ways that they need us to. So we're a survivor-led program. We provide mobile advocacy as well as in-person advocacy here in our clinic, as well as flexible financial assistance and other therapeutic supports. We've really had to rework our program a lot because most of it was dependent on people coming into our clinic. So we've really expanded our telehealth to serve folks that can't come in or don't feel safe. And we've also just been working really closely with our departments here. And I'm really proud of the work, again, that UIHI has done around supporting survivors during the pandemic. They actually released another report called Supporting the Sacred, Women of Resilience. And that they surveyed survivors of domestic violence and sexual assault across the country, Native survivors. And those survivors told their stories and contributed in a really beautiful way, identifying the community resources that have been really important to them and their healing journeys, but also where the gaps are. And it's really important for us to see where those gaps are. So I know for our program, we're working towards providing more robust virtual support groups, because especially with this Delta variant, we know that available services are going to have to start looking different.
Yeah, just to echo what Stephanie says, like pre-COVID, the rate of domestic violence in tribal communities or indigenous women is 4 in 5 women, and that's already, a high number. So since the Coalition to Stop Violence Against Native Women is not a direct service provider, the way we have addressed this issue is just trying to support our advocates. And this is a question that I ask our tribal advocates often, and the advocates that we serve, the advocates that serve Indigenous relatives. How are services going? What are your barriers? How can we support? And what are your numbers like? This is an ongoing assessment during our advocate community meetings. And often the feedback is, numbers are back up again. We have been busy. We are short staff due to illnesses or loss of family member. And so much is happening in our lives, and as advocates, they just need more support now than ever to continue to be there for our survivors and their dependent children. I hear it in their voices, the empathy that they have for their tribal communities. But that's what's great about these meetings is when we have them bi-weekly, we start off with a training first, and then we help each other. On the next meeting, it's pretty much a safe place for us to share how we are really handling it all. And so yes, I would say it is a trend in most of our tribal communities. And there are reasons why. The reasons why it's gone up is because of the stay-at-home orders. Our offenders are in the home more often with the survivors now, and then villages being closed. And some villages are stricter than others. And that's only to protect our tribal communities. But that enables our survivors to leave and access services. And technology is not always accessible. So we see this as a violence at the Coalition because most of our Indigenous relatives do not have access to internet and devices.
Tiffany, that's actually the entire reason that we've been in person the entire pandemic. Like fully echoing what you were saying about technology is a lot of our folks don't have the access to technology. So we want to be able to provide the virtual support, but we also have to still maintain in person. Again, SIHB serves a lot of unsheltered folks and a lot of folks that don't necessarily have consistent internet, don't have consistent technology. So even with our support groups, that was an issue. So really finding creative ways to support people, help them be safe, but also make sure that they know that we're here and that they're able to access us.
Yeah, at the very beginning of COVID, I remember hearing some of our advocates saying that their numbers had went down because they felt that the survivors in their area were unsure if services were even open. So yeah, you bring up a really great point about being in person and available.
In my role, I can't speak, and I'm fairly new to Isleta and the services and the connection and coordination to understand the impact that this shadow pandemic has on the tribal community. So I can't really speak to that. But what I have seen just in general, because I've been studying COVID this whole entire time, just in my role as a public health administrator is, I'm actually interested to see what impact these lockdowns have had, because it could be a risk factor for, the shadow pandemic, kind of to where Tiffany was saying, the lockdowns, yes, we're balancing trying to protect and keep our communities safe, but a lot of our communities suffer from social issues. And I don't think through this whole pandemic have we even really addressed the social issues that really are devastating. So, I think we're not going to know this until who knows how long, right? We don't know how long COVID's going to be in our community. but it's definitely a learning factor for me in really weighing out the pros and cons to lockdowns, because you do have a lot of social issues that plague tribal communities in varying degrees, because every community is different. And so not every community is going to respond and have the outcome than other tribes. So it's interesting to see going forward what the how conservative, I guess, each tribal community is going to be now that we know that there are shadow pandemics, and now that we know there are other social factors that come into play when really trying to protect the overall community. I know COVID is one thing we're really doing a lot of effort in protecting, but there's also other issues. There's economic issues. There's, even just looking at child well-being, how safe our children are. And our population does suffer from a lot of low socioeconomic status. So it's hard to be restrictive when we know our families need jobs, we know our families need access to food, safety. And so I'm really interested in the shadow pandemic for those reasons. And it's really hard to implement policy on a tribal level when you really do have to think about all these other factors that come into play.
Kristen, thank you for saying that. In April, the coalition held its Tribal Leaders Summit, and we facilitated a discussion on the shadow pandemic. And we actually got to hear from 3 tribal advocates who serve survivors of domestic violence and sexual assaults. And we talked about this, and we were hoping, that tribal leaders were in attendance, like governors, lieutenant governors, and tribal council members, so that they can understand, that issue, and hopefully could move forward in providing adequate services within their own tribal governments that are keeping our survivors in mind and safe. So thank you for bringing that up. It's a very important issue. And I hope that it continues to move forward in your office. And if you meet with other individuals at, doing the work that you do in other tribes, that this is also something that is brought up.
So for National Indian Health Board, we recognize the importance of maintaining our intimate partner violence programming during the whole pandemic, and also provided 6 of the webinars throughout the pandemic as well. And one of them was including the IPV and child abuse during a pandemic. The other one was Mending the Rainbow, addressing intimate partner violence and working with the Native Two-Spirit LGBTQ community as well too. And a lot, as I had mentioned before, we also do all tribes listening sessions, and one specific topic we did was on IPV. And then we also provide a IPV Institute for our virtual 2021 Tribal Public Health Summit, and that was addressing intimate partner violence and Indian Country Institute as well too. And in addition to all of the IPV programming, NHB is honored and is proud to partner up with the organizations like Coalition to Stop Violence Against Native Women, and that are doing that tough work, and which is also what I refer to as the heart work, which is the heart itself. So, and that keeps a lot of our Native mothers and sisters safe, and also in the path to healed as well too. So those are some of the things on, at least for NIHB, that I would like to share on this topic.
Thank you, Kristen, and thank you all for answering this question. For me, I always like asking this question just because the issue of the shadow pandemic has really kind of been a question that I've been posing since the pandemic, and since I started working for the coalition. And when I learned about this, it was just something that I needed to hear others speak on and hear their perspective. So this next question is, what are some ways tribal communities cope with staying safe while social distancing? And this is especially in mind that for many tribal communities during the pandemic, some of them might have not been able to practice ceremonies, or one thing that I remember that came out of the pandemic was the social distance powwow page on Facebook. I just wanted to hear what the communities that you're involved in, what are some of the ways communities are staying safe, coping with staying safe, and uh, especially with regards to hosting ceremonies and etc. So we can start with Stephanie. So.
Yeah, I know for me personally, it's been very hard not having access to ceremony like we usually do. I know like I personally really have to frame it as like protecting the folks that like have taught me everything, you know. So many of our elders have passed on, so it's so important for us to. I mean, you know, you see so much happening online, even right now. So outside of my capacity here at Seattle Indian Health Board, I'm also on the board of directors for Native American Lifelines of Baltimore, who's participating in the Youth Gona at the moment. And it's such a really wonderful resource for the kids in our community out in Baltimore. They're participating virtually in this Gona, but then they also got these like gift packs from Lifelines so that they could participate and like have something physical as well, because I know for me, like in my community with ceremony, like we have our giveaways, we have our feeds, and those are so integral to how we relate to one another and like how we build our kinship, you know. So I love being able to see stuff like that. Also, for my program, what we're putting together are these self-care kits for people that are on our caseload, but also putting together a bunch to have on hand for when somebody's coming in crisis or wanting to do an intake, because we really want relatives that are coming into our program to feel welcomed and to feel connected, even if they're not able to physically be there, if they have to do virtual appointments, etc. Because that is a really important aspect to our program culturally. Yeah, so that's what we're trying to do.
Yeah, I can't speak for all 23 tribal nations in New Mexico, because that would be very wrong. But during our advocate community meetings, we do talk about how we are feeling, you know, when feast days do arrive for us, for each of us. We know it is a huge part of who we are and a way of life that is missing, and it's painful. I'm sorry, I get so emotional when we talk about our culture and our traditions. And I think we do our best to stay hopeful that next year or the following year will be safer. I know personally for me, it's hard to not see and be with our community. Our people are becoming ill with other illnesses. For the Pueblo of Isleta, we have lost up to 9 tribal members due to COVID, and many more losses to other things that happen in our community, such as alcohol and other illnesses like cancer that's so that exists in our tribal communities in high rates. And it's hard not to be there with family and to not be able to cure our people. Right now in my tribe, there are no ceremonies happening. And my own opinion is I don't think none of our tribal communities are safe to start ceremonies again. All we can do is try and carry on with prayer in our own homes and teaching our little ones our language every day. I see this as another historical trauma event in the future for sure, because our generation of COVID won't have access to healing ceremonies and our culture. But our tribes have survived 500 years of colonization, so I am hopeful that we continue to survive through everything else that is going on.
I guess I can just speak personally in terms of really missing the traditional ceremonies and activities and really being with family, because that's really what pulls us together when we do have our ceremonies, and it provides a healing component to it. But I mean, I personally still pray every day, because this whole year has been very traumatic for communities, but even as practitioners and providers on front lines, it's very, very, it has been traumatic. And so I pray every day, and that helps me every day with my healing. And I feel like, I hope that we can get through this pandemic so that we can go back to having those activities and events. But like Stephanie said, you always have to keep in mind what will happen, if we start to gather again too soon. And it's always, you want to, it's scary. It's still kind of scary. And so I think other ways that communities have coped, I think, is I've seen on Facebook, like a lot of the drum groups seeing on Facebook, and that's been comforting, right? To hear songs that you haven't heard in a while. And I think, me personally, with my family, we just keep always talking about and talking in our language, but also just going on YouTube and seeing some of the YouTube videos out there has been comforting too. And just a level of hope, right? And to keep that hope that we will get there again. But it's just right now keeping us all safe, and practicing safe practices so that we can get there. And I'm hopeful that soon we will be able to.
I am right there with you, Tiffany. I am also a product from my elders and my grandparents, teaching me all about the traditional healing. So it is very, very close to my heart when, this has been a limitation and it has been a challenge. And, and it is something that has been hard throughout Indian country at all. Every tribal community has struggled with this and on every aspect. And it's true that not being able to gather for prayers and participating in ceremonies, it really took a toll on our tribal members and especially our elders. They are the traditional keepers of our songs and our dances. And last spring, NIHB um, partnered up with some of the traditional healers out there to put out guidances around participating in traditional healing practices like sweat lodges, and as well as the hardest topic, which is funeral services. We want to hear from them. We want them to tell us how to put this out for them, because yes, CDC can send out all these guidances all they want, but when it comes to our people, we have to be very specific, and we have to know, what we're telling them, and really not to tell them, but for them to give us that guidance to be able to share that out with all of our tribal members as well. And many of the native families, they lost loved ones to the virus, and it was hard and extremely painful, as we're talking about it here. And to mourn and you know um, to have those funerals as well too for each of our family members. And you know, as a Native mother, as a Native woman, this is something that is really close to my heart, that I'm very protective of some of the ways that we do as tribal members. And, we continue to be challenged with that grief and trauma too. So, which is why we actively advocate for expanded services and increased fundings for behavioral and mental health, as well as the traditional healing. And that's one of my biggest thing is traditional healing. For one day Medicaid, we can get reimbursements for our traditional healing. And the state of Arizona right now has a waiver with CMS requesting for that. So I'm hoping and I'm praying and crossing my fingers, anything I have to do to see if we can get that passed. And also, we hear from our board members and some of the community members that some tribes were taking unconventional approaches to connecting with each other. And um, and so one of the example I can share with you is that a group of the St. Regis Mohawk women, they started holding prayer circles using Zoom. And so, yes, we had to change our ways. Yes, we had to maneuver and pivot differently. But they found those different ways of doing that. And with our youth and our young adults, having to go home and also do remote school, also taught our elders that there's different way of communicating. And one story that was shared with me was um, a grandparent, for the first time realized how to use FaceTime. And it's so interesting that it's called FaceTime, right? So, she's talking to her family and she's putting up the phone right directly up to her. But what she didn't realize was that on the other end, all they could see was her forehead. And so, we found ways to be able to do that communication and teach from elders to the youth and be able to have that community going as well too. And that's who we are. When we're Native people, our family is our community. And our traditional and ceremonial practices, that takes a huge part in who we are. So I agree with every single one of you. Thank you for this question.
Kristen, that's really beautiful, and I think that a lot of us are really experiencing so many of similar things. Tiffany, what you were mentioning about losing people not only to COVID, but to other things as well, and it's really hard because I know a lot of folks feel really disconnected, and I know I personally have experienced a lot of loss and a lot of folks that I've lost due to addiction. And relatives here in our clinic that we've lost because of that, because it's been really hard. Um, and I'm really, really thankful for the privilege that I have to be working at a Native organization and to be working in this Native space, because we have our traditional medicine practitioners that are here in our clinic, that they always prioritize our survivors here, and our unsheltered folks. And they hold that spirit of what our medicine people are supposed to be. And we've lost so many knowledge keepers and so many language keepers and so many medicine people this year, that every time they come through and cleanse our building in the mornings and in the evenings, I'm just so thankful for what they're doing.
Thank you all so much for providing your perspectives. I wanted to provide some comments from the Facebook Live. Bev Billy stated that I think the hardest is the inability to have a traditional burial for our relatives, especially the elderly, with a sad emoji, eagle, and roses. And Tiffany responded with, "Yes, Bev Billy, that has been the hardest." And so I'm glad that we had a moment of reflection for this question, because I think that sometimes in non-Native spaces, we don't always get the opportunity to discuss the importance of ceremony to ourselves and to our well-being. And so thank you all for your perspectives. And I hope moving forward that I think this is an opportunity to learn about our medicine and what keeps us strong, and to test our resilience, like as an individual, and how to bridge community in the face of adversity. So in the interest of time, I want to move on to I'll read out the questions that we won't be able to get to, but I really wanted to ask the last two questions concerning our community needs. So I'll read out the questions that we were going to ask so that they're available for reflection. But we'll go to the last question. So the next question was, could you describe the balance between the economic impact of COVID-19 and safety for tribal communities? This was really reflecting on like the economic impacts of like such as casino openings and other ventures for the tribal communities and balancing it with COVID-19. The next question was regarding the vaccination rates and the challenges for urban areas and for rural areas, and how you worked with the challenges regarding vaccination rates. And then this next question is, in what ways did you or your organization adapt to meet the needs of survivors, advocates, patients, and community members? And then finally, our last question, which is, what is our community needs moving forward? And what are some of the barriers in our communities in moving forward? So we can start with Stephanie and go from there. So, and I'm sorry for, there were so many questions I had that I wasn't sure if we were gonna get to all of them, but I'm glad that we made it through the ones that we were able to so far.
Absolutely. And we have such a really wonderful panel here. So it's understandable for us to have so many questions. You know, some of the highest needs, again, like kind of going back to that supporting the sacred report that UIHI came out with, is some of the highest needs is like around self-care and mental health support. A lot of our respondents have talked about their need for being able to take care of themselves, but then that's like almost in like competition with like meeting basic necessities. This pandemic has put everybody economically at a very difficult place. I know in Washington we've had a moratorium on evictions, thankfully, so people haven't been allowed to be kicked out of their housing because of non-payment, because it has had such a huge economic impact. But that rent is going to have to get paid at some point. So people are in a bad place. And so trying to take care of yourself while also trying to like make ends meet is really hard for our community members. I'm really like stoked here at Seattle Indian Health Board because we have so many different departments that work really, really closely together to help people meet these needs. So like our homelessness investments program, they help not only with our unsheltered relatives, but also folks that have rental arrears and are at that might be evicted. They actually have been able to administer a federal grant through this, well, it's through the state of Washington, but it's using federal monies to pay back owed rent and to pay a few months ahead of time, because we all know that like if you have thousands of dollars of debt, it's really hard to even think about moving forward. So really helping folks bridge that gap has been important. And we've been working really hard to try and do that in tandem with also taking care of and keeping in mind spiritual and mental health and social and emotional needs, because those so often get pushed to the side. And I think, you know, communities of color are constantly like told that they're supposed to push those needs aside, you know, just keep moving forward, put your head down, just keep moving forward. And our people need, like, they deserve better than that.
Yeah, I definitely have to echo what Stephanie says. And that's along the lines of where I wanted to go with this question. Our community needs moving forward. I would definitely say shelters. Shelters are a huge need in tribal communities, whether it's homeless shelters, domestic violence shelters, more funding for homes. Everyone deserves a home. It doesn't matter what kind of lifestyle they're living. Everyone deserves a home. No one should be without a home. Every child deserves a safe place to live, a safe place to lay down, and a safe place to learn. That is our foundation. And I just have to say that everyone deserves a home. And we have seen, with the pandemic, with the shadow pandemic, a lot of our unsheltered relatives also became that number had increased. A lot of our relatives became homeless because of the pandemic. A lot of people lost their jobs because of the pandemic. And as a community, I'm speaking just, from my tribe, I think we need to pull together and support one another and not take away those jobs, not take away their living, because how else are they supposed to support their families right now, especially in the middle of a pandemic? And it's scary. It's scary that this is actually happening, and it's unfair. And I really hope that the money that each tribe had received really consider this is, creating funding for homes or for shelters. That is a huge need. I think it's a huge need moving forward.
So I think the other need that I've seen working in 2 different tribes through this whole pandemic is really resources for populations that are transient and high risk. And kind of going off of what Tiffany is saying, it was very difficult for us to quarantine or isolate individuals who didn't have homes, right? And the other thing that I think is really, really important that tribes should really look at, and even national organizations, is looking at how self-sustaining we are as tribes. So when we're put in a position where we have to lock down our communities, a lot of our tribal communities don't even have access to a grocery store in their own community. We don't have access to a lot of the resources that the state would have access to or a city would have access to. And I think so we really have to think, even on a tribal level, how self-sustaining are we? How are we as a tribe really using our sovereignty to be able to be self-sustaining so that we're not having to rely on other resources? And I think this was a very eye-opening experience for me, even coming from a healthcare perspective. Like how have we built our healthcare systems to be able to respond appropriately to pandemics? How do we treat and respond and monitor individuals who are experiencing, who are trying to get, over a disease, and in a way that it was more telehealth, right? So we could really build our capacity around telehealth. We could build our capacity around technology in terms of having access to internet, being able to take care of people in their homes, I think is really important. And we used to do that. I was a public health nurse and I'd always go to homes, but we've lost sight of that. I think the way that the healthcare system nationally is going is we're losing that relationship that we have with patients in the community. And I think this was really eye-opening, because if you had a trusting relationship with the community that you serve, it was easier to take care of people. But if you don't have that, it's harder to build that trust while you're trying to respond and take care of people. So I think those are some things, and even some barriers that I've experienced in trying to really help communities to be receptive to how we're going to treat and respond, but also how do we go forward? How do we, as tribal communities, be able to be self-sufficient?
Those are some really, really great points. And you asked that question, what are our communities' needs? And, when the pandemic hit, you saw all the news stations, you saw highlights of exactly what our tribal communities are suffering. We saw the needs. I mean, it's I mean, a list full of things that needs to be addressed. And our communities need a firm commitment from the United States government to continue to provide COVID relief directly to the tribes, and with minimal administrative burden, because that was one of the things that was really hard when, yes, they obligated this money, but the tribes, it took them a long time to get that funding. So and this funding must be reoccurring as all to advance the tribal public health infrastructure and the capacity and allow it to be sustained. And the tribal public health infrastructure was largely neglected over the past century, which resulted in reduced capacity for tribes to protect their people and continue to provide the necessary public health programming to address that violence against Native women, such as the IHS Domestic Violence Prevention Initiatives and the Choctaw Nation Domestic Violence Awareness Program. So, our Native women who are mothers, daughters, sisters, aunties, nieces, they deserve a chance to heal. So, whether that's seeking counseling, traditional healing, or any other type of behavioral health or mental health services, here at NIHB, that's what we advocate for, and that's what we're, passionate about when we're talking about what are the needs for our tribal communities and for each of the tribal members, and just seeing what will happen, just down to even water. You know, we shouldn't have to be struggling to find water to wash our hands. And we're talking about the United States here. It seems like we are like the third country within United States. So, um, those are some things that we focus on at National Indian Health Board. And I think some of the um, other barriers. Are we going on to the other question for Felipe?
Yeah, you can answer
Okay.
both like in the same breath, but yeah.
Okay. Sure. So the tribal public health infrastructure, so it's still in its infancy. So the substantial and reoccurring funding is vital for developing and strengthening and sustaining that public health service in our tribal community, which I would say plays a key role in protecting the Native women against violence as well too. So those, we think about those kind of things.
I just want to
Thank you.
jump in
Oh, go
here.
ahead.
Yeah, I'm going to highlight some of the comments that have been put into the chat. So from Angel, tribal communities need to get comfortable with demanding internet as a human right, a human basic right. And then Tiffany was saying, yes, our tribal communities were not prepared for COVID. And then Stephanie Cassidy saying the disconnection between community members and the healthcare system is frustrating. We have Angel saying Doctors Without Borders were deployed to tribal communities during COVID. That should put into perspective just how behind our communities are in respect to the health infrastructure. And then also Chastity here saying, after all the deaths, you would think our country would have free healthcare and even down to the cost of staying alive for those that have COVID and stayed in the hospital. Thank you all for your comments.
Yeah, I agree with everyone. Those are all important things to consider moving forward. And just remember, like, the US government has always tried to assimilate us. So when I say that tribes were not prepared for COVID, that's what I mean. We didn't have infrastructures. We don't have access to water. It's so sad that, some of our Dene relatives don't have clean water to wash their hands. And it's so frustrating. Like Kristen had said, we live of the poorest of population in the US, and we're the first people of this land, and it makes me so angry. I think our tribal government leaders really need to demand and start demanding all of the things that we see as gaps with COVID-19.
Thank you, Tiffany, and thank you all for providing your perspective and comments in the chat. So I just want to do a quick time check. We are nearing the end of our presentation of our panel discussion. So it's 2:31. And so I think with that concludes our discussion today. I just want to say thank you, Hutgam, to all of our panelists, Stephanie, Tiffany, Kristen, and Kristen, for joining us today, and for my fellow staff members for just helping me with hosting the event and ensuring that we could share it with our relatives on Facebook. So Honey has put an evaluation link in the chat. And so please, if you are a participant, fill out the evaluation and provide us feedback so that we can continue to improve these events. And yes, if you have to go, please go. I am aware that we're slated to end at 2:30, but thank you all so much. That really concludes our event, and I appreciate you all for being here. So thank you.